Colin Furness joins me now. He's an infection control epidemiologist. Colin, good morning. Good to see you.
Good morning.
So, what do you make of the latest case numbers? We are at a level that we haven't seen since before summer started.
It's a natural consequence of a pattern of loosening restrictions. We know as we loosen restrictions, we increase social contact and we can expect more cases. That's what we're seeing now. I don't believe this is the beginning of the second wave quite yet, but it is setting the stage for it.
It's setting the stage for it. So, what is the second wave going to look like if it's not this, Colin?
You could expect a much sharper increase in a much shorter period of time, and that would coincide with the onset of much colder weather. The virus is very happy in cold weather. It will spread much more easily. So we're giving it, unfortunately, a little bit of fuel now, and that's concerning, obviously. I would like us to roll back some of the loosening of restrictions that we've had.
Okay. You may have noticed there's a slightly different tone this time around from both the provincial governments and the federal governments as we get ready for a second wave. They say they are prepared. So, what have we learned since March?
We have learned a lot. We have learned a lot around pinch points and bottlenecks for things like personal protective equipment for healthcare workers. We have learned where COVID likes to go. We have learned what its attributes are. We've learned that it's asymptomatic and that we can't just pay attention to people who look really sick. We've learned quite a lot. We haven't acted on all of those things everywhere effectively, so I think we could improve how we respond. However, back in March, I think we were all terrified because the answer to most questions was, we don't yet know. So now we do.
Now we do. Some of the hospitals are starting to express concerns about the increase in numbers. What do you make of those concerns, and how do we get behind them and support our hospitals, our hospital workers?
The best way to support hospitals and hospital workers is to maintain physical distance and wear a mask and do everything you can to not get sick and not make others sick. I think the situation facing hospitals is less dire than it was in the spring, mostly because we have a better idea of who is most vulnerable. And I'm quite convinced that people who are more vulnerable are being more careful. And where we're seeing a heightened number of cases now in people in their 20s and 30s, they're able to make a lot of people sick, but they're not necessarily going to be as desperately ill themselves given their age group. So I don't think we're going to see the same rate of hospitalizations in the near term. The key is for everyone who is vulnerable to be extra vigilant.
Okay, again, I want to get back to this issue of the second wave because we hear that phrase so much. We know that's what happened with the Spanish flu, with the pandemic back in 1918, 1917, 1918. So is it inevitable, Colin, that this is going to happen, even if we physically distance, wear a mask, wash our hands, do all those things that we now know that we're supposed to do?
In my opinion, it is inevitable. But what is an open question is whether it will be small or whether it will be big. I think mask wearing is going to interrupt the virus very well. And I believe that we can be optimistic that we're not going to have a very big second wave. But it's something that honestly, that's speculation, and we're just going to have to wait and see.
Okay, Colin Furness, always great to see you. Thanks so much.